I'm Dr. LeeAnn Brady, and I want to actually talk about one of the most unique bite registration materials available in dentistry, and that's Luxabite from DMG America. So Luxabite is unique in that it is not a silicone-based material. It's actually a bisacril-based material. And so when we think about bisacril materials, those are the same materials that you typically use to make provisionals. So you can already get a sense of one of the things this material has. It has superior rigidity. One of the challenges with silicone-based bite registration materials is they're flexible, they're compressible, there's a sponginess or a springiness, and so when we mount models, it can introduce an error. This material has none of that, and because of its rigidity, we get much more accurate mountings. So whether you're using this just over the prep of a tooth so that you can do a bite registration for crown and bridge fabrication, you can use this and you can actually do traditional CR bite records, whether you're doing that with a leaf gauge or you're doing it with a bite stop or a platform. This material is phenomenal for that. But I have to tell you that I've actually come up with a couple of different uses for this material that don't actually use it for bite records, but take advantage of the fact that it's cartridge based, it's in a gun with a tip, and it's in a completely self-curing and rigid material. And what I use it for is replacing places that I used to use lab acrylics or methacrylates. So like pattern resins or like pattern resin, things like that. So what's a classic example? So really common for me that I actually have to take impression for implants where I have multiple fixtures and I want to tie them together. I want to make sure that we've got that so there's not even the tiniest bit of micro movement in between those impression copings so that we get a really, really accurate fit of what we're doing. So bridges all the way up to more complex hybrid type dentistry. So what I will do is I will actually put the impression copings against the fixtures. I'll actually use floss to kind of connect between the implant impression copings. And then the Luxabite can actually be flowed right around the impression copings over the floss, contain the floss, and we almost can create a custom transfer jig. And this material is phenomenal for that. Speaking of transfer jigs, if you do get transfer jigs back to get accuracy and to make sure that your fixture level impressions and analog models for implants are accurate, I've been using my Luxabite to actually connect the pieces, the jigsaw puzzle pieces of a try-in or a transfer jig that I get back from the laboratory. And one more that has to do with implants is really common for complex hybrids, zirconia hybrids, for me to do an open tray impression where we're actually going to get a custom tray from the laboratory and we're going to actually lute the implant impression copings to the tray. And then we're going to use a whole bunch of holes in the tray to inject the light body material around there so that we pick up the tissue profile. And Luxabite has really been the perfect material for actually going ahead and connecting those impression copings to that custom tray. Do make sure you block out. You don't want to get the Luxabite down around the multi-unit abutment or the housing of the actual fixtures in the mouth, but it's a great material. And because it's dual cure, you don't have to worry about managing light curing units. So if you've not tried Luxabite, I encourage you to get it for your practice, and you will probably come up with as many unique uses for it as I have, and just using it for what it was designed, which is as a really phenomenal, rigid bite registration material.